Hi, I'm Nancy Walker. I'm Jasmine's grandmother and I'm 66 years old. I've been on Medicare for about a year and a half, and with Medicare, depending on your financial status and your earnings, it's based on that. The basic monthly amount is around $134, but ours is a little more since our income is a little more since my husband is still working. We have the supplemental plan through AARP through Corning Glass, and fortunately, Corning gives us a supplemental amount of money to each year to pay towards that supplemental amount because it can get a little expensive depending on the plans that you get and everything. And then we also through AARP and Corning Glass have the pharmaceutical part that helps pay for prescriptions that maybe Medicare won't pay for, or they won't pay as much for certain prescriptions. It just kind of helps subsidize that as well. Once Jasmine came to me and asked me about speaking about Medicare, we get a book each year kind of telling you different things that Medicare covers, different things that you may want to think about if you need to make any kind of changes to your supplemental or to the Part A or Part B of Medicare. And so I started looking through this book, and I was a lot of things that I realized that I honestly didn't really know about Medicare. I started drawing my Social Security at 62, so when I turned 65, Medicare automatically signed me up for the Part A and Part B, and then I had to, of course, go out and get my supplemental plan. If you are still working, you have to go down and sign up for Medicare at 65 because everyone has to sign up for that, even though you have a health insurance through your company possibly. You still have to sign up because Medicare then becomes a supplemental part on your um, hospital plan that you have with your company. I like being on Medicare because you know that you're insured, and that even though the supplemental is a little bit expensive, if you have to go into a hospital, if any of you've ever been there, you realize that it's can be very costly going in, even if you stay one night, or if you go to the ER, how expensive it can be depending on what you go in there for. So it's nice to know, even though we're having to pay possibly more than we did when we were actually working and had health insurance through a company, it probably still is less than if we had to go out and buy an individual plan from a company. Medicare is possibly still a lot cheaper, even with our supplemental and pharmaceutical expenses that we have. One thing to also think about is long term care. Um, Medicare does not cover long term care unless you go in the hospital, and that's not really long term care. If you go in the hospital, Medicare will pay for you to go to a um, facility that has a rehab, which is a lot of times is a nursing home, but they have a rehab section to get build your strength back up. And Medicare will pay for about 28-30 days for that. And also, if you're at home and you have a caregiver that's taking care of you, they can also take you. Medicare will pay for you to go into a nursing home for a short term of like 30 days, just to give the caregiver a chance to get some rest from being having to take care of you for 24/7. So it would be a good thing to look into long term care policy. They can possibly be real expensive, but it's just something to think about in the long run. My mom, she was in a facility, and she was 91 years old, but she was actually on Medicare and Medicaid because her income was so low because my dad passed away years and years and years ago. So her income was low. So what they do there is they take her, so they would take her Social Security check, and that paid for her long term care. And then I guess Medicare and Medicaid ends up paying part of it, or the state or something. But it's still something that you need to think about. Medicare is great, but it's different for different people for income and financial status and what might be going on in their lives. But it's still a great policy to have. Overall, I'm glad that I'm able to have Medicare and have the coverage that I have and not have to worry about possibly having a big hospital expense to have to be in my income. Since you are retired, you are more on a fixed income than if you're working. So it's just a lot of things to think about and to do a lot of research on, and just go online, and there's different things that Medicare is trying to do to make it better each year so you can understand it. They're trying to work to get things electronically done that you can go on and see your hospital bills and your pharmacy expenses and everything. So it's just a good policy to be on. So good luck and just do your research. Thank you.
Hi, my name is Marceline Bradshaw. I'm 70 and I'm Nancy's cousin. I want to talk to you today about Medicare. I have been on Medicare for about 5 years now. It takes. I can't do this. Let Nancy do this.
Okay, start over.
I just can't do it.
Just say start off by saying I've been on Medicare for. Smile. Don't look that mad.
I'm trying to smile. I've been on Medicare.
Let's just do it with one.
Oh my
Yes.
God.
Let's just do it with
Do
one.
it with just one.